This exercise is intended to relieve leg pain by making the lumbar nerve roots and sciatic nerve glide back and forth through the space where it is impinged or entrapped, thus allowing it to move more freely. This is accomplished by pulling on one end of the sciatic nerve while simultaneously providing slack on the other end. Next, the movements are reversed, producing a flossing movement as the nerve glides back and forth along its path. Start in a seated position on a surface that allows your legs and feet to swing freely. Sitting comfortably upright with your knees bent, flex your head forward so that your chin moves towards your chest while also bending the knee on the painful side and pointing the toe. This moves the sciatic nerve towards your back and away from your foot. From this position, you'll begin to move your leg on the side that hurts, straighten your knee until the knee is fully extended, and pull your toes toward you. Simultaneously, lift your head and extend your neck until you are looking up toward the ceiling. This moves your sciatic nerve toward your foot and away from your back. Move slowly, simultaneously, and in a coordinated fashion. It should take around 5 seconds to complete each cycle of movement. Start with no more than 10 cycles, and you can gradually increase the number of repetitions over time to a maximum of 50 cycles per day. It's best to start this exercise no sooner than 2 hours after getting out of bed to allow a decrease of the internal disc pressure. It is normal to feel sensations in your back, buttock, leg, or even foot during these movements as long as these sensations do not last more than 15 minutes. If your symptoms remain worse after this exercise for greater than 15 minutes, stop the exercise and consult your prescribing clinician. A common error associated with this exercise is performing the movement too quickly or abruptly in a jerking type of motion. Make sure to perform the movement in a slow, controlled manner. Another common error associated with this exercise is performing the movement without pointing the toes properly. Make sure the toes come toward you when you lift the leg and the toes point when you bend the knee. Another common error associated with this exercise is performing the movement while tipping your head or torso to one side or the other. Make sure to tip your head straight down and keep your torso centered in a straight line.